do something as much as I can to help them.
Yeah, that's great. Great insight. One question I wanted to ask related to that is outcomes, right? Like what
Yeah.
are you looking for when you're measuring the success of these patients?
So, I mean, most common question we ask them, how much pain you have, now. And they will say, like a 4 out of 10 or 7 out of 10. And we will say, do you feel you overall improved compared to last time? So sort of like we call global perceived improvement kind of thing. They'll say, yeah, I feel like I'm 20% better or 40% better. They can give you like a kind of like a number. And then you have like a rough, impression. This is actually heading toward the right direction. Then you also will ask the function level. Say, like for that, you ask them, how many blocks you can walk now. They will say, yeah, I can walk, to like half mile or a mile. Then compared to before, they only can walk like 2 blocks. They have to sit down to take a break. So those kind of things, I actually pay more attention to the function level. I mean, that seems to me is more important. I want a patient to be more functional. So that's why I typically will ask a lot of the function level questions. So those are the major things we can assess how successful or how unsuccessful the treatment is.
Yeah, no, that makes sense. What about an unsuccessful treatment? What usually goes wrong or causes issues?
Well, I mean, certainly, the wrong diagnosis, may be, one of the main reasons. Like, for example, for back pain. So if you do epidural for a patient with the main problem is axial pain. So we call AXIL as axial pain. Basically, mostly it means either muscle, fascia, or from the joint. So for those patients, the epidural, it doesn't work well. And the epidural mainly works for the radicular pain, for the sciatica pain. So if you make a wrong diagnosis, then you offer the wrong procedure. And the patient, they tell you, say, hey, the other doctor, did 3 epidural and nothing. I mean, I didn't have nothing. Then I ask them, say, what's the pain? Did your pain shooting on your legs? No, my pain is still on my back. It's like a cross, both sides, and going to my buttock sometimes, but most of them stay on my low back. So then I will feel like, one of the reasons is because, you did not receive the most appropriate injection for your condition. So that's one reason. The other reason is for chronic pain patients. And depending upon if they are works comp and they have secondary gain, and they don't even have the desire to be better. So in that population, it's very tough. No matter what you do, I mean, it's nothing going to work for them because they are not even interested to get better by themselves. And also some patients is for some other reason, like they want to looking for meds, and no matter the injection you do, no matter what kind of other medication you try, they keep saying it doesn't work, I cannot sleep, I cannot function. They just really try to push you to the point that you say, okay, let's put you some opioids. I mean, those are kind of common also, you see a failed case like that. And certainly the other thing is like a very severe, like, sclerosis. And there's really nothing I can do. I mean, it's such a bad anatomy. And no matter what I do injection, I mean, I have to be honest. I mean, there's nothing I can really change that. Or for somebody with like a very diffuse, like arthritis, I cannot poke everywhere. I can only rely on medication, but medication doesn't work on every case. So those time, I mean, I have to say there's nothing else I can offer. Or some patient with fibromyalgia. So those people mainly is the mental issue, and instead of like a more physical problem. I mean, for those patients, there's nothing I can offer with my injection. So I mean, those are the major reason why failure for the therapy.
Yeah, there's something interesting you mentioned just now and earlier that sometimes like depression and mental issues are associated with the more chronic conditions.
Yeah.
Understanding, the opioid epidemic that surrounds us, how does that play into your decision making, knowing that there's a lot of abuse potential or psychoactive properties that come along with this?
Well, I mean, overall, I think the whole nation has a major shift, at least in our pain management field, in past 2 years since since the CDC released